with respect to the transparency, you're right. There are a lot of requirements. I mean, the hospitals do have a lot of requirements. I think when dealing with healthcare, we're in a maze of information. It's a highly complex area to navigate. I say this all the time, but I think it's true. I think people are reluctant to question sometimes when it comes to healthcare because it is so complex. People question their electric bills or cable bills all the time. If it's $1 over what you thought it would be, you're on the phone in 5 minutes with the cable company. But when it comes to healthcare, people don't tend to question. And I think that's because we present information in such a complex way. It's really hard for consumers to feel empowered enough to engage and be heard, feel like they're powerful enough to make a difference. And that's why the APCD, though it's been delayed, is a really powerful tool. Once it gets up and running, it will be very powerful for consumers to actually compare prices across the state for different kinds of procedures, as Senator Giarratana said. And I do think you're right that there's a balance because of the methodology that Medicaid and Medicare use to pay versus commercial insurance. But I don't necessarily believe that it's right for consumers to be paying a charge that might otherwise feel like it could be handled differently or more appropriately if it were lower, whether they're a commercial patient or a Medicaid patient or a Medicare patient. I really think we have to delve into the legitimacy of some of the fees and the derivation of some of them and go from there. But
it's almost as though it's a user fee when there should be broad payment from the Medicare and Medicaid program to cover this, and instead of using people who happen to be, it kind of flies in the face of what good insurance policy would be if we were providing coverage for everybody.
Well, right, but I also think that because Medicare and Medicaid spend a lot of money on health care, they're expecting, as John said and everybody else said, the system to move towards value instead of just payment out of pocket for services as rendered. And I think the system as designed, we're all at kind of fault for the way the system has been designed, which is a fee-for-service-based system where it's better to order more procedures because you get paid more. So Medicare, while may pay less, and Medicaid, I don't necessarily think that's a good rationale for moving the costs onto the commercial side. We do it, but it's not necessarily the right reason.
Thank you so much. Thank you, Mr. Comptroller.
Great. Thank you. Vicki, thank you very much. Appreciate your testimony.